All right, part 4 lecture video for chapter 13. We're picking up on slide 37. So, final physical inspection. Just a recap here again: technician check, pharmacist check, and the final check is looking for precipitation and cloudiness. So, the storage of compounded sterile products. The label specifies the correct storage amount or storage requirements. So that's temperature, exposure to light. Some things are light sensitive. So we have brown, they almost look like amber Ziploc baggies that we would put the IV bag in to protect it from the light. If it's not immediately delivered, we must re-inspect it. The pharmacist must re-inspect it before delivery. So let's say there's a couple hours in between when you make it and when you actually deliver it to the floors. A pharmacist needs to visually check it one more time. So priming administration IV set. So the nurse will hang the IV bags one at a time, and a nurse or a tech will prime the line. So typically the nurses are responsible for priming the IV lines. However, if it is a chemotherapy, the pharmacy staff will prime the lines. Okay. Vial and bag system. They are assembled in a clean room environment. So you have a bag. If you look at the picture on slide 39, there's different types of bags that have a little attachment on the end. And then you see that's where the vial has been attached. These are very, very useful because these here keep the expiration dates longer. So when you attach it to that vial, the nurse will have to physically break the seal and start squeezing the liquid into the vial, mixing it up, and then suctioning all of the powder and everything back into the IV bag. They are not considered us physically sterile compounding, but because we are attaching the bag to the vial, it needs to be done in a clean environment. The technician will attach the vial to the bag of diluent in a clean room and label the products. Again, the benefits of this is it's safe, it's effective, it's efficient, and it's cost effective. Frozen IV solutions. So the benefits of frozen IV solutions, because they're already pre-made, so less waste, later expiration dates, they stay good longer. Reduced risk of microbial contamination because we're not physically compounding those. They're already coming pre-compounded. They're less labor intensive. We're basically taking them out of the refrigerator, laying them on a countertop to thaw. You want them to thaw at room temperature or in the refrigerator. You do not want to do what they call a forced thaw, which means warming a bath, warming up a sink of water, putting it in the microwave. That is a no-no, okay? You will label the product once it's completely thawed out when it's going up to the unit. The expiration dates vary. So we had bulk bags of certain sizes of, let's say, cefazolin is one of the bags we got frozen. We would thaw those out, and they had a 14-day expiration. Once they are thawed, they cannot be refrozen. Criteria for the CSP reuse. So storage conditions must remain in compliance with USP Chapter 797. A compounded sterile product can be redispensed only when the pharmacist or the pharmacy technician is certain that it has remained sterile and chemically stable during its storage. New patient-specific label must be generated. In the case of proprietary vial and bag systems that have not been activated, they may be returned to the pharmacy for reuse and labeling. So those Adapta bags that we talked to, if the nurse didn't need it, it hadn't been activated, we can pull that label off and put a new patient label on there and send it on its way to another patient. Hazardous drugs, drugs at risk that have a risk of being carcinogenic, tetragenic, reproductive toxicity, organ toxicity. These are all classified under USP Chapter 800, which describes the proper handling of hazardous medications. So routes of exposure for hazardous drugs, trauma or injury, so an accidental needle stick, or accidental cut on your hand or other part of your body from a broken container. Inhalation, you've inhaled a fine mist from a broken bottle, or if there's poor manipulation technique. If you're not wearing your face mask, if you're not wearing your face shield, okay? Ingesting powder particles when crushing an oral tablet. Direct skin contact, so accidental spills. So acute health consequences, so skin contact resulting in a skin rash or an allergic reaction. Long-term effects, higher risk for skin and bladder cancers, leukemia. Acute health consequences could also include infertility, miscarriage, neonates with low birth weight, or congenital malformation. So it's actually recommended that women who are pregnant or plan on becoming pregnant in the near future should not do any chemo or hazardous drug compounding. Each hospital must have hazardous drug policies and procedures in place that protect the workers, and the technicians, along with all of pharmacy staff, must be trained in these procedures. Protective clothing, so there are specific standards set by USP Chapter 800. A disposable, lint-free, impervious, closed front gown with cuff sleeves. That means that it must be closed in the front, okay, but that the material does not absorb anything that's spilled on it. It just runs off, okay. If it's an absorbable form of fabric for the gowns, they cannot be used in hazardous compounding. Hair and shoe covers, eye protection, face mask, and 2 pairs of gloves. So the eye protection is protecting your eyes from any of the mist or the powder or anything getting in there. So we're covering up all of our openings here. Remove and discard all protective garb before leaving the hazardous drug preparation area. So double gloving is actually required for the preparation of chemotherapies. Tuck disposable gloves under the sleeve cuff of the gown. You'll place the chemotherapy gloves over the top of the gown cuff, okay? So it's gonna go on top. Turn gloves inside out when removing and discard them in a sharps container. So we have yellow biohazard or chemical hazard containers for our chemotherapy items. So in the red sharps container is biohazard as far as blood, regular needles, sharps containers, but the yellow ones are specific to all hazardous drugs, and that's where you're going to be placing even your gloves. Your biological safety cabinet is a specialized hood used to prepare chemotherapy and other hazardous materials. The HEPA filtered air blows downward and outward through the backs and the sides, so it's preventing it from coming at you. The contaminated air is filtered either to the outside or back inside the cabinet. Shield at the front of the cabinet stops about 8 inches from the work surface. A compounding aseptic containment isolator, which is actually what we have in our pharmacy, that's our hood, means the vertical airflow of the hood is used to prepare hazardous materials. So the type of hood we have, we actually could prepare hazardous materials in there. It's fully enclosed. The hands are placed into fixed gloves located in the front of the cabinet. So your hands go in fixed gloves. It's a completely closed box. The supplies are brought into the hood through an inner pass-through window. Supplies and controls. So your closed system transfer device. So this safely draws fluid from a vial into a syringe and then injects it into the IV. Your compounding chemotherapy mat is a thin mat that is used to soak up any potential fluid spills and prevent fluids from seeping through down onto the hood surface. A chemotherapy dispensing pen is a device used to relieve the negative pressure within a medication vial. So instead of just puncturing it with an open-ended needle like we would a regular drug, they actually have a very contained pin that does not allow that that powder to just seep, the extra air to just seek out. It does equalize the pressure, but into a filtered system. Okay. Hazardous agents and vials. So you want to make sure that you're using a chemotherapy pin, a dispensing pin. Slowly inject your diluent into the vial. You don't want to push it all in at once. If you add too much pressure in at once, it could actually explode the vial. You want to allow the excess pressure from the vial to vent into the syringe. Withdraw the drug from the vial using the negative pressure techniques so that no drug is actually leaked or aspirated out. And then you'll inject the contents into an IV bag. Hazardous oral drugs. So if you're doing any type of unit dose packaging, there's still the same requirements. So if you're taking it from a bottle and you're putting into prepackaged unit dose for specific patients, you still must wear your gown, your gloves, and your respirator. You will clean the contaminated equipment after you do that. You will not use any machines. So we have what we call a unit dose machine that we can put in a whole bunch of tablets at a time, and it works its way around, and it will pre-package all of the medications. You cannot put any chemotherapies in there, hazardous drugs, penicillins, anything that could potentially be contaminated onto other tablets. So let's say if I did penicillin, it's a very powdery tablet, and there's parts of the machine that I can't physically get in to clean. So the risk is that some of that powder will be transferred into a different round of prescriptions that I'm trying to unit dose, and what if that patient is allergic? When you are receiving hazardous agents, your gloves must be worn. Any damaged packages should be inspected in an insulated area such as a vertical hood. Receipt of broken vials should be treated as a hazardous spill. Your storage, you will deliver directly to their stored area. So all of your hazardous drugs are kept completely separate from your regular drugs. You will have your storage areas that shows and has warning labels as to what those drugs are. Access to storage and work areas for hazardous materials should be restricted, meaning, you can't just, freely walk in and out of there. You must be donning and garbing up. We kept ours actually in the chemo room. Storage should be maximize product recognition and minimize any potential for breakage. So, having enough shelf space, being very careful that we're not adding too much to a shelf where we can have stuff fall over, tip over, that type of thing. Priming of your IV administration sets. Because they are hazardous products, the nurses will not prime. The pharmacist or the technician who is preparing the IV will prime the tubing for chemotherapy or hazardous drugs. So PPE generally worn for cleaning, disinfecting, decontaminating, and deactivating the compounding areas. So decontamination is the removal of hazardous drug residue from surfaces. Chemical deactivation requires 2% of sodium hypochlorite, which is bleach, and not alcohol. Hazardous spills require PPE and hazardous drug spill kit. There's actually a video you're going to watch on the chemo spill kit and how to use it and what's in there. On slide 56, it tells you the steps when you're using a hazardous drug spill kit, and that's something that I want you to review. Okay, on slide 56. Procedures in case of exposure. So if the skin is exposed, you want to flush the area immediately and then cleanse with soap and water. If your eyes are exposed, you will flush with your eyes with large amounts of water or use the eye flush kit. So every pharmacy must have an eye washing station. You will remove and dispose of any contaminated garments or gloves. Your hands must be washed thoroughly. You'll escort the exposed worker to the emergency room. You will have to report the exposure to the supervisor, who will then complete an incident report. Radioactive pharmaceuticals. So a nuclear pharmacy is a pharmacy that prepares radioactive material to diagnose and treat specific diseases. So they are prepared in, these radiopharmaceuticals are prepared in nuclear pharmacies, not hospital pharmacies. So there's a very specific pharmacy, it's called nuclear pharmacy, that these are prepared. Specialized technician training is required to work in a nuclear pharmacy. USP chapters 821, 823 outline the requirements for this type of compounding. And that completes this lecture and this chapter. If you have any questions, be sure to give me a call or send me an email.